Welcome to Success Redefined with Dr. Toni Warner. I'm Dr. Toni, mom of five, psychotherapist, author, and mentor. Here, you're going to find insightful discussions spanning science, psychology, and soul as the personal and professional meet, and we explore the intersection of what really matters. So success can be redefined with connection, healing, and fulfillment in mind. We're going to talk about mental health from the perspective of being both a mental health provider and receiver of mental health services in a mental health system that's got gaps and issues that many of us know, see, and understand need to be addressed. And so I'm joined by Heather Herman, who's a triple certified nurse practitioner with over 21 years of experience in healthcare. And she's worked in community health, family practice, college health, psychiatry. She currently has a private practice where she does provide medication management and psychotherapy. And her lived experience with mental health challenges like postpartum OCD, birth trauma, all of those experiences have really helped her to feel passionate about improving access to care and normalizing seeking care in a proactive way. Her goal is to see mental health services integrated in all areas of society so that one day we can say, wow, Americans actually take mental health seriously. It's everywhere you look and just a routine part of their day. Let's hop on in and talk about if and how we can possibly feel more successful as we navigate a messed up mental health system and the silver lining that might actually exist here. Hello, Heather. Thanks for being with us today.
Thank you so much for having me. I'm so excited to be here.
I'm glad you're here because I know we got to have some conversations kind of in a different forum before, but you were so down to earth and also you had this multidisciplinary approach as a mental health worker, and then also we had this connection just as ambitious women and moms. And so I was like, oh, I think that we might have a good conversation that's going to be able to serve a lot of people and probably even serve us with whatever we have
Yeah.
going on in our
Yes.
life right now.
Yeah, absolutely.
Okay, so let's talk about mental health. And that's a huge, 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 huge topic, right? But you're a mental health worker. I'm a mental health worker. Can you tell us first a little bit about what your approach is to mental health, what you do as a mental health worker, and maybe even a little bit about what brought you to that field to get us started?
Oh yeah, absolutely. So I'm actually a family nurse practitioner, and then I'm also certified as a psychiatric mental health nurse practitioner, and then I'm also certified in perinatal mental health. So in my career, I really started out on the medical side of things. I did family practice for several years. I did college health for several years, and then I transitioned into full-time psychiatry. If you had asked me when I was a nurse, if I would have done that, I would have said, no, that will not ever be how I work. But when I did family practice, I did a lot of mental health just in that role. And I found that we had a lot of limitations in access to services. And I found that I did a lot of chronic disease management that had a mental health component to it. And so when I switched to college health, I was really excited about having the opportunity to do primary prevention and do early intervention, do a lot of education, and really help people be more proactive at an earlier age to take care of their health. And I found out really quickly that their needs in that area were much less on the physical side of things, and they were very much on the mental health components that were holding them back. And I started to really realize how early the mental health components come into play and how impactful they are on our physical health. And I ended up really liking that population. I got to know my clients. It tied in a little bit more to family practice where I'd kind of known entire families and got to see that systems work. And I ended up moving into psychiatry, and that's really part of what I bring into the work that I do now. So I do some therapy work, I do some brain spotting. That's how we first met. And I also do a lot of medication management and really helping people tease out what is medical and what is mental health, and really helping them understand how those are actually integrated. They're not two separate things that operate independently of one another. They really are integrated, and I help clients understand how it can really have a whole picture view of health and wellness, and that includes the mental health components.
Yeah.
So that's really kind of how I work with clients.
That's awesome. So you said two things that sounds kind of contradictory, but aren't.
Mhm.
And so I want to notice that and maybe piece that apart a little bit. So you said you help people tease out the mental health and the medical health piece, but then you also help them see that they're not two completely separate things, that they are integrated, that they impact, right? That they affect one another. How do you like how do you do that? What are the ways that you have found that it works for you to present that to others in a way that makes sense?
Yeah, so I think one of the really common questions that I get is I see clients who sometimes come to me because they know I do both medication management and therapy, and they're really frustrated and overwhelmed, and they're carrying so much stigma about seeking help that what they need help understanding is what is a medication issue and what is a therapy issue, and what is right, like I want my labs tested. Is this a physical problem? I know I say on a regular basis, is it ever not trauma, right? And helping people understand that the physical symptoms that they're having can have a mental health root to them that needs to be explored, and helping them understand what our goals are with medication and how medication can fit into that part of the puzzle. And that sometimes looks like working with clients who have chronic mental health problems, who are maybe like feeling stuck on a treadmill and they're just not getting where they need to be as far as their physical health goes, and helping them understand how we can identify some of the mental health components of that and how that then might work well if we coordinate with their specialist or if we include that in their specialist care. So it's a little bit about understanding what's therapy and what's medication and how those can work well together, but also how you can get care from your specialist and you can get care from your mental health provider, and the two together are going to have impact on one another.
What is it, would you say, that makes this multidisciplinary approach so important to you? You like you personally, what is it that
Yeah,
makes this such an important thing? Because there is so much mental health need. There are so many medical health needs. And I also believe that they affect one another, right? It's not just completely separate
right.
entities that never impact one another. That's not how it works. Although that is sometimes how they are treated,
It's definitely how they get treated often, right?
right? So what is it that makes this multidisciplinary approach really important to you?
Yeah, so I think that really has been highlighted in a few different ways. For me, probably the most obvious, like, personal experience was when I was doing my training, for perinatal mental health, and as I was in that training, I have 3 children. I had hard pregnancies and hard deliveries, and I actually had postpartum OCD symptoms, especially with my first one, and when I did that training, I realized in hindsight that I had had those symptoms and that they really hadn't been treated. And I really started to understand how I needed other people who I had contact with to help me to get that care, and how really hard it would have been for them to get through to me, in all honesty. I had contact with my OB, right? And I had contact with my kid's pediatrician, but I didn't have contact with a mental health provider, and I didn't have other people who were recognizing what was happening. Partly because I was doing a really good job masking that up, and partly just because the people around me didn't know what to look for or how to help me. And I started to get really interested in that training in another piece, which was how important it is for new moms to feel like they're capable and competent, and to be reassured and to have a safe space where they can ask questions without judgment. And as I was doing the training and we're thinking about how we build up those resources for our clients, and we're talking about doulas and we're talking about the OB staff and the pediatrician staff, I realized that we have so many more other people that need to be on the table, right? That we need our social workers there, we need our nurses there. And if more of those people were trained, then we just might have so many more opportunities to identify and then help the people that need care get the care that they need. And so I think it started there and it felt very personal. I had, like I said, I had complications with my deliveries. And when I look at some of the things that I went through, I should have been an automatic referral, right? Like you could have looked at what had happened and said, you know what? You're going to need some therapy, right? This is a lot. And that doesn't happen. That's not routine. And there's a lot of systems reasons why that doesn't happen. And so I got interested in that area. And then I started to notice, wow, it's not just in this field. Like our endocrinologists that are working with clients on healthy eating and diabetes management and autoimmune disorders, their clients really need some connection with mental health support. Clients that are with chronic pain disorders, they need mental health support. And we don't operate that way. We don't do those referrals in the way that we might do other referrals. And so I just kind of, the more I thought about it, the more I thought, wow, we've got a lot of work to do here.
Because mental health is such a gray area, right? It's one of those, what do they call it? Soft sciences. You
Sure.
know, it's
Yes.
one of those areas where it's not quite as tangible in the outcomes that they want to measure, the evidence-based aspects of research that they want to be able to plaster here or there, or to get funding, and there's all that stuff. So my background is as a clinical social worker, but outside
Sure.
of the therapy office, when I would do social work in communities and schools and consulting and things like that, a huge part of what I did, of what I spent my time on, was making those connections because people
Yes.
just didn't, they didn't either they didn't think of it, they didn't know how to do it. They were too busy because they themselves were bogged down from X, Y, or Z that they had to do in their work. It was scary to
Sure.
them because they didn't understand the mental health aspect or what the person was actually going through. And I
Right.
was a connector. I was a collaborator in from the school system to the hospital system to the community resource system. And I mean, it was all over. And it was fascinating how something that sounds like it's so simple, right? Let's make
Mhm.
connections. Let's draw some lines,
Yeah.
right? Like let's connect the dots and fill in some gaps here. It sounds so simple. It First of all, it's not really that simple because it gets complicated by a lot of political red tape and funding and things like that.
Yeah.
But it makes such a difference.
Yes, absolutely. And I noticed when I went back and did my psych NP, I will be the first to admit, I had been practicing as a nurse practitioner for years, and so, I was working full time, but in my mind, I thought, "How hard can this be?" Like, I've done, mental health work, and how hard will it be? And I learned so much, and it really opened my eyes to how little mental health training most medical providers get in their basic training. Unless we choose to do additional training, we really don't know how to make those referrals. And then the way that mental health workers tend to work makes it really, really challenging. There are insurance issues, there are turf war issues, there are administrative issues, there's some liability concerns. And as I went into private practice for myself, I really started digging into that and seeing a lot of systems issues where we really aren't doing well. And we have a lot of potential to do better, right? So, I mean, the good news is when we find out we're not doing well, then, well, we've got a lot of opportunity ahead of us. And that can be exciting. And I think that we're in a place where that's really become critical.
Yeah. I remember when I was 302'd, which in Pennsylvania means you are mandatory placed into a
Mhm.
hospital.
Sure.
And I had such a negative, unsafe experience in that hospital. So it was a co-ed.
Yeah.
I was 19 or 20, and it was a co-ed floor of adults. I was on the adult floor because I was 19 or 20.
Sure.
And there was this full grown man there that was literally trying to push his way into my room onto me. And the staff
Yeah.
was non-existent, like nowhere to be found. And the
Mhm.
only reason I was safe was because my roommate stepped in, who happened to be a recurrent
Right.
patient at that hospital, which I didn't know at the time and had found out later on. And it was just, there was like, they didn't tend to my mental health at all while I was there,
Yeah.
which was astounding,
Mhm.
astounding to me. All they
Yeah.
wanted to do was try to get me on a medicine. There was no talking to me, there was no therapy, there was not it was a very
Wow.
negative experience. And when I left with this like flame reignited under me, right? Because I was studying to be in the mental health field at that point. I was a what was I, junior, senior? No, no, no. I was a sophomore. I was a sophomore in college. So I was already studying to do clinical social work. I had known I wanted to do that. So I had this fire reignited under me when I left. I was like, this is not okay. Like, our system
Then
cannot
well,
be set up. Like,
yeah.
that was not helpful. Now,
Right.
in retrospect, it was helpful in that it reignited that fire within me, right? Um,
There are other ways to put it more kindly, right? Like, we don't need to traumatize people to find their fire.
not a good idea. That's just one of the things. There were other things. But so when I left, I was, air quotes, like this honors student that was involved in a bunch of extracurricular activities. I was a leader
Mhm.
in many things. I was up for a ton of awards as a residential assistant. And when
Sure.
I got out, the administrators of the resident assistance department took me
Yeah.
in and basically said, "You're a bad influence." This was a month out from the end of the school year, right?
Yeah, which is right when finals are coming, like, that is a very stressful time for
It
students.
was it was
Uh,
It was so it was
Not
as if
normal.
nothing I did
Yeah.
the entire year mattered anymore. None of the rewards I was up for mattered
Mhm.
anymore. Like, none of the praise that had been sung, so to speak, mattered anymore, right? All of those high achievement things that I would push myself to do, none of it mattered anymore because I was hospitalized because what they call suicide attempt. I called it something different, but I understand why it was called a suicide attempt. And they said basically because you are struggling with depression, right? And you were hospitalized, you are not a good influence and we can't have you continue this last couple weeks or month of.
Which is your job and
Yep,
is tied into
yep.
financial, right? All of those determinants of
It
health,
was
right?
insane. And so they made me resign. So I resigned and I still to this day can I have this disconnect in my mind of no one spoke to them about the mental health needs of their leaders. Like, even outside of
Yeah,
the hospital system, right, which you would
right,
think is a given, right? Mental health
right.
needs.
Which happens all the time, right? You see clients who are just discharged, you get no documentation, right? And no letter of support or and discharge planning starts at admission does not mean how quickly can we get them out the door for the greatest return on their visit, right? It should be how are we going to help them succeed when they are discharged back to the community? But so many systems are failing there, right?
Yes, yes, and it's just astounding. Now, obviously, I don't know if
Mhm.
anything has changed between now and then. This was many, many years ago at this point, but
Yeah,
I remember that. I can still remember feeling like, wow, they have no awareness of mental health, but how to
yeah,
treat mental health, how to work with their high achieving leaders that are many of whom are their
right.
residence assistants, their graduate assistants, right? That they're leading, like that they're working with. They have no awareness of how to work with their mental health. And maybe my story, maybe my experience impacted them in such a way where they went down that avenue. I truly do not know. Um,
Sure.
but I remember feeling viscerally feeling the gap that you're talking about here, where disciplinary teams are not coming together on a college campus there's an entire department that focuses
Yeah.
on mental health. So it's not even that it was a lack of resources available, right? They were right there available on
Right.
the campus,
Yeah.
right? So it wasn't even that, but it speaks to just even one avenue of what you're talking about here, of the difference that it could make if they had brought in a consultant, a mental health consultant from that department, and said, hey, this is what we're working with here. Can you sit in with us as we sit down with Toni and have this conversation and explore the different, options, and rather than pathologize her and basically tell her she's bad and that she's got to go and nothing she has done matters, right? So
Yeah.
there's so many facets to it, but I wanted to share that part of my story because I think it's really tangible. It's understandable, right? For people to hear and be like,
Yeah.
"Oh yeah, there are gaps. There are challenges with our system and we have this mental health need."
Absolutely. And I think that you're highlighting something that's so important because when I decided to go back for my psych NP, I was working in college health, and part of my motivation for that was I had some situations where clients were at really high risk for a poor outcome, and we could see that risk. And there were policies in place in higher education, and this was not unique to the university I was at, that were really punitive, and they really did not serve students well, and they were not medically sound. They were basically just a liability move, right? Like, how do we reduce our liability? And you had the people that had the power to make the decisions that were not necessarily mental health providers, or they had a different role in that system, right? And I wanted to be able to come to that table with enough training to have a voice. And I felt like that was really, really important because what you described is very common, that we see clients and if we can, we're going to help somebody stay outpatient. And there's ways that we can do that. But in order for us to be able to do that, we're doing that partly to prevent further trauma, but we need a community that's involved, right? Like, we need our faith-based communities to have training and support and resources, and we need our educational systems to have training and support and resources. And then we have to find a way to make that where it is accessible to everyone. And that includes looking at some of the financial components, which we're really uncomfortable talking about in our country. And that is a whole nother awkward conversation. We look at burnout in physicians, we look at burnout and turnover in mental health workers, and it's staggeringly high.
Yes.
And how are we working to improve that? I feel like one of the most important things is we do our own work, right? And for a lot of other healthcare workers, that stigma is so strong that they're not getting their own mental health support. But how empowering it would it have been if someone in your system said, "Oh, you know what? I work in therapy and I've learned this is really, really helpful. And it sounds like more of our students maybe need access to that. How are we meeting that need?" Right?
Mhm.
But instead, we're so isolated, and we just are not letting our systems work for us, and we're not making our systems work for us the way that we need them to.
Yeah, so when we
Yeah,
operate in those silos, it further
absolutely.
complicates the matter, right? And so I was telling you before we hit record that what
Mhm.
I wrote down as part of, our overarching conversation today was that we want to feel successful as mental health workers and people who need mental health, but
Yeah,
live in a society with messed up systems.
absolutely, yes. And how do we change that? Yeah, yeah. And I think that it can very easily become really defeating, right? It feels like beating your head against a wall when you are working in systems that are failing, especially if you feel trapped by those systems. When I made my move into private practice, I was really in a place of burnout, and I made that decision, and then started exploring different ways that I can work that felt fulfilling to me and would better meet the needs of my clients. And I realized that there can be a lot of toxicity there, right? So this system is failing, and I cannot tolerate being in that system anymore. And there's a big movement, I think, if you are in those communities where mental health providers are trying to struggle through and figure out how to stay in the work that they're doing that they care about without feeling like their own mental health deteriorates or they burn out. You hear a lot of people leaving that system and saying, okay, then I'm not taking insurance, or I'm not working with this client population, or I'm finding a way to exit myself from the system, or I am leaving the profession altogether. And so I think that we have to work at figuring out some ways that we can do this work in a way that's meaningful to us and it serves our clients well without being so burnt out, and with remembering that we want to serve all of the clients who need us, which includes the clients that are low income and are marginalized and really have some legitimate logistical challenges to accessing care. And that's really hard to do when you're also like, but I also have my own family and I have to pay my own bills. And how do we make that work? And that I feel like is where we're really, really failing right now.
It's so multifaceted, right? Like we're multifaceted as human beings. And also the challenges that we're talking about, here on this podcast, they are also multifaceted. As you were saying that, I remember when I switched to private practice, and I did a gradual switch. So I was still doing my kind of 9 to 5, so to speak, social work positions in other areas. And then I was doing some private practice certain evenings of the week. But I remember I was in my car and it was crying. It was crying outside. It was raining outside. I guess it's the same as crying outside. So it was raining outside. And I realized, parked in my van in this parking lot, that I could not take insurance with my private practice. And I had been working hard to try to do that.
Right.
And what I realized was it was not possible for me to create the work lifestyle schedule that I wanted to create, to also be a present mom, leave my 9 to 5, my day job, and pay back the student loans. Right. In addition to just,
it never ends for us, right? I don't know how much you have to spend a year on continuing education, but it never ends for us. I don't think people realize quite how expensive our educations are.
It continues on, right? And I wouldn't be able to financially or psychologically afford it. I wouldn't be able to.
Right.
And I had an existential crisis, and that's not an exaggeration. I broke down crying in my car. I was sobbing. Like I had all of this shame that I had to shed around being a bad social worker or being a bad advocate because I couldn't accept insurance and like, all of these shame messages that I didn't even realize were happening for me. I had to shed them. I just sobbed and I sobbed. And I'm not someone that like just breaks down and sob but like during those first 2 decades of my life, I tried hard not to be someone who broke down and sobbed, right? And I at the end of that sobbing section, I did let it go. I did. But you have to go through that in order to allow myself to find a place to peace. So that I could say, I want to show up as a mental health provider of quality, right, to the clients that I work with. And I will not compromise showing up as a quality mother either.
Yes. And it's so hard. I mean, we just are always looking for those extra hours in the day, I think. When I switched to private practice, I am not exaggerating when I say I had a moment where I literally grounded myself on the ground because I was realizing it really kind of brought up a faith crisis for me that my values are to be generous and to share and to serve the poor. And realizing how logistically challenging that is, and without carrying a caseload that then I burn out. Like if you were my 10th patient of the day, how well can I show up for you, right? And I want to show up well, and trying to puzzle that together. And I remember laying down on my we had a little sidewalk in front of our house, and it was like sunny and warm. I like literally lay down and watch the clouds. And my kids walked by and they just stepped over me and were like, "Oh, I was having a moment, I guess." As I really kind of wrestled with, if that is my goal and I want to show up in that way, I have to find a way to also take care of myself. And that is really a requirement in order to be able to do this work. And noticing, like, wow, our systems really aren't working for us. If I want to be able to do that, then what for me that ultimately looked like was like, I'm really curious about other ways to serve, right? So for me, I have a course that I don't really market, but I should. That's like very well done, I think. Or I have a couple books, and I know that you've authored books, right? So really getting creative about, if I want to serve, what are all the ways that that could look like, so I can find that balance and meet that need, and also not burn out. And we look at the burnout rates, and we look at the suicide rates in healthcare providers, and we look at where we're really not doing well, and we've got to have those conversations. We've got to model, right, the mental health that we want our clients and our culture to start to shift to, right?
Yeah.
Um,
I agree. That's a similar question that I needed to ask myself was,
yeah,
one, am I willing to accept that it's going to look different in different seasons of my life? Am I willing to
yeah,
accept that, right?
mhm,
And two, that there are different ways that I can serve. And
yeah,
is that okay? And
right,
if we come to this, underlying question that we always have in this podcast, which is redefining success, that really is exactly what I'm talking about here. I had to redefine for
mhm,
myself what it meant, what it looked like for me to feel
yeah,
successful, not just look outwardly successful, but to feel successful in how I'm showing up in my work as a mental health care provider, as later on as a mentor, also as a mom, as all of these different facets in me. How do I really want it to look? How do I really want it to feel? I need to get clear, like on changing that definition, because the old one wasn't working, or it just maybe
right,
needed some addressing,
yeah,
right? Needed to be
yes.
addressed.
And I think for me, and, we work with clients all the time about finding curiosity and flexibility, right? And for me, I found that the kindness had to come first. And that was like a real shift, because I think I was holding on to a story that, um, if we got flexible and we problem solved, then we could be kind once we found the right solution. And I was really letting that part of me drive the bus, and really what I needed was some kindness first. And then once I could show that kindness, then I could start to be really curious about, wow, I have more years of my career, and how many different ways do I want to maybe show up and build community and build connections and be an advocate. And recognizing too that, like, if we cannot pay our bills, then we're not able to do that. And there is some advocacy power that comes from that kind of stability. And that's really hard for healthcare providers. I think many of us went into this field to serve others, and then to work in these very broken systems. Finding a way to do that so that we can continue and we can build that community is really important. I do think part of the reason that mental health gets thought of as such a soft science is because we don't tend to look at the determinants that insurance companies prioritize. And part of that is because we're very disconnected from one another. We work in our small private practices versus these large centers. Um, and that's something where I think we have so much potential to grow and to develop. So I think even though we see these challenges, there's really a lot of opportunities ahead.
There and isn't that the gift, right? That challenges bring us, systemically or otherwise, right? Is that when
Mhm.
there are challenges, when we're willing to look at the challenges, look at the yuck is what I call it. You look at the yuck, you
Yes,
look at the suck,
absolutely.
you look at the stuck,
That's what it
you
Yeah,
look at it, and now we can become more aware of how we want to address it, what we want to do about it, get a better idea of what's going on so we can shift it. I do think that we are in a bit of a pendulum shift here,
mhm. Yeah,
collectively, and so for many individually as well, where we are questioning that. You were talking about that a little bit earlier. A lot of people either pushing back or exiting in certain mental health fields or in certain healthcare systems. And that's happening for a reason. And I think that's just part of the shift that, the
Or
process that has to happen for the progress to occur. But
mhm.
I find that when we have conversations like this, it can
Yeah.
be in and of itself really powerful and normalizing for other folks out there that are either mental health workers or are
Mhm.
navigating the mental health system. One of the ways that I have found to serve, um, it's varied over the years. So, like for example, I would do some free or low cost groups in the community or through church. I used to do that. I'm not able to do that anymore because I'm 8.5 months pregnant, and this is my fifth, and I just had another one last year. So I'm in a different season, right? And in this season, I offer a lot of things online for free or low cost course, like you said, a low cost course
Mhm.
where I'm able to support. But even in my private practice, I offer certain, I won't call it necessarily a sliding scale, but it's a discounted rate for those that are in need. So I'm able to support those that I'm a good fit for, that are a good fit for working with me, right? That might have
Right.
a financial need. And so I find these different ways to be able to serve that feels right to me, that feels good to me. Doesn't mean it's right for others, doesn't mean it's good for
Right.
others, right? And I think so often we want to
And we're all at
say,
different seasons.
yeah, this is the
Yeah.
right way. This is the wrong way. Shame on you for doing it that way. Or, oh, it worked for me
Yeah.
this way, so you do it this way. And the cookie cutter
That
approach
doesn't serve
doesn't work.
anybody well.
Doesn't work.
Yeah. Yeah. And I think that's really what we wanna see and what we think about when we think about social justice is that freedom of choice. And we're wanting to enable all of us to have that freedom of choice. So it's not like find the right way, it's how can I work within, or maybe I create my own new system in a way that's meaningful to me, which means for me that we don't leave behind the people that maybe don't have those same resources that I have, right? And that capacity and how I flow in that is going to change over time as I try things and they don't work and then I try again, right? Um, and having the capacity to be able to tolerate that trial and error process, that starts with that kindness and that curiosity because otherwise in our system, it's just like beating your head against a wall some days, right? I'm on a treadmill getting nowhere. And how do I help these people and how do I do that in a way that is kind to myself as well, right? It comes back to that kindness and that curiosity, but
Absolutely.
I think we have options, right? It doesn't have to be this or that. It could be this and a little bit of that and maybe a sprinkle of this and then readjust accordingly.
Yeah. Yeah. So if we were to go back 20 some odd years for you, and
Yeah.
you are, starting out in your healthcare career, really like
Mm.
you're just, yes, like I'm ready to go and I'm ready for this and I'm passionate and fueled up. What would you say in retrospect, your definition of what it meant, what it looks like to be a successful, not just a successful mental health worker, but a successful multifaceted woman, right? So mom, mental health worker, like what what was your definition of success back then?
Oh, yeah. So I was definitely and like the part of me that needs an A is really strong. So, I was definitely I have the degrees. I did very well at school. Like, I definitely had that achievement-oriented focus, and one of the things that was really freeing to me was having the option to choose, right? Am I going to grow? Am I gonna do this next thing? Um, and maybe I'm not because I don't want to, versus I am on this path and you do the thing and there's a right or wrong. So I think my initial concept of success looked like hitting the achievements. And that might look like forgetting to celebrate the achievements or to do the thing and then immediately move to the next thing and to climb, climb, climb. And don't know. When I was younger, I think I had an idea of I would have time when I had an unrealistic expectation of what having children would be like. So I think I thought I would, work a reasonable schedule, and then I would come home and I would, enjoy my vacations, and I would like I had that very cookie cutter mold of you do A, B, C, D, and then you get A, B, C, D, and that is success. And I don't think I really gave myself options or I had enough experience to have a very realistic perspective, right? I heard a speaker once say, I'm thinking about whether or not I want to expand. I kind of like where I am, so I may just stay here. And I thought, wow, what a radical perspective to have that clarity of, oh, I get to pause and I get to consider what matters to me. And I don't have to continue to grow. She was referring to size of her practice, unless that really fits where my values lie and how I can best serve someone else. And I think the much younger version of me would have said, oh yeah, right, you just keep going, 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 like an Energizer bunny. That is a great way to get really tired.
Oh yes, the one of the top paths to burnout, right?
Yeah, yeah, yes.
Definitely relate.
Yeah, I think it's very freeing. So my track is I'm a nurse, and then I was a family nurse practitioner, and I was a psychiatric mental health nurse practitioner, and I did my perinatal mental health certification. And um, when you work in the medical setting, right, it has that like military background, and there's orders, and there is sometimes a subservient mindset between colleagues and not necessarily a team approach. And I've seen that play out in a few different ways. Um, One of the things that was really freeing to me was to allow myself to make those kind of choices, right? Like, am I aiming for a status, or am I aiming for a lifestyle, or am I aiming for meaning? And those are not the same things. Yeah,
Yeah, absolutely. So that segues us a bit into our final question for today, which
sure.
is with where you're at now in life
Hmm.
and taking into consideration the life you've lived and what you've learned, but even just our conversation today,
Yeah.
what would you say your newly redefined definition of success might be for you?
Yeah. So I think for me, when I think about what I keep coming back to as I like make the next steps, and I have to keep coming back to this over and over intentionally, like homework. um, I have to really do the work, is that I want to make sure that when I look back on what I have accomplished, that I feel like my contribution was meaningful and it aligned with my values, which might be different than somebody else's values, and that's okay. But that's what I really hope for. And I think that's really freeing when you think about some of the financial pressures of the schedule and the kids and the needs. And I'm definitely a sandwich generation person. I feel the pressure of elder care and children care. And um, at the end of the day, I think that those things are going to be okay if I have really managed to keep coming back to, okay, well, where are my values? Like looking at that choice point, am I on the path that's bringing me closer to that? Did I get astray for a minute? And if I did, why? And how do I bring that back together? And I do get astray all the time. That's part of it. And I can be kind to myself and curious when that happens.
I love that. I love that
Yeah.
for sure. That curiosity, that
Mhm.
awareness, and then what we do with it, right?
Yeah.
Is there
Yes.
space for grace? Like you're talking about the kindness, the
Hmm.
self-compassion, because when we have that for ourselves, it's more likely for us to have that ripple out to
Yes, absolutely.
others.
And what a great thing to model for the people around us, right?
I agree. I agree.
Yeah.
Oh, Heather, I loved this conversation, and I think that there are so many different layers to it because there's so many different systems, right, that we're working with. But
Absolutely. Yeah.
I think that regardless what we covered today is a good place for someone to begin if it's where, they're kind of questioning, what am I doing here? Like, what am I doing here? I'm not really feeling successful. But also for someone that's been on that journey of questioning and maybe is needing to reflect in a different way, because I am the same as you were just saying, like, I have to come back to intentionally checking in with
Mhm.
myself, checking in with myself, checking in with myself about these things.
Yeah.
And we can be really hard on ourselves about that, or we can treat it as part of the part for the course, right? Part of
Yeah.
the growing process. And I think
Yes.
this
Over and over.
conversation helps people
Yeah.
to do that.
Yeah. And what a nice, beautiful thing to still be growing, right? We hope that we're still growing. And I love just the idea of if we're doing this together, we're all on our own paths, but we're really welcome each other into that conversation. How beautiful is that? And what could come from that? And hopefully something really nice.
So true. For folks that would like to stay connected with you, follow you, find out about your work, where could they do that?
Yes. So I do. I have my website that I maintain. I have a second project that is my never ending project that's not quite ready yet. But as soon as it's ready, I will be posting more on my social media. I'm currently doing a social media pause. So I check only for the essentials, and I find that works really better for me. And so I'm actually playing around right now with the freedom to maybe not do much social media. So we'll see how that goes.
Heck yes, I hear you. I have done that many a times over the years. And, it looks different for different people. But for me, when I have done it, it has been good. It has been a
Yes.
good thing for me. So
Yes.
kudos to you. Is there a
Yeah.
website where folks can find you at?
Yeah. It's just joyspringmentalhealth.com.
Wonderful. Wonderful. Any other last words or tidbits that you would like to share?
Yeah, I just wanted to say thank you so much for inviting me and allowing me to be here today. I think this is such a great conversation. I'm just so excited about your podcast because I just love all that you're doing. So I'm just super grateful to have been invited. So thank you.
It is my pleasure. Thank you for coming, for sharing, for showing up. For everyone that's joined us out there in the audience, thank you too for coming and allowing us to share and being receptive to some of what we have said today. Whatever needs to hit, let it hit. Whatever you're struggling with, recognize that too, right? We all have our areas where we struggle sometimes. Sometimes we're ready to tackle it, sometimes not quite so much. But if you're on YouTube, hop down below, check out the comment section, add your comments, contributions, questions, whatever it is that's going to serve you best and meaningfully right here and right now. Until next time, everyone, go out, have a day that feels successful, and allow that to ripple out in a positive way to others. Bye. Links related to this episode can be found in the show notes section. Want to submit questions about success, satisfaction, healing, and relationships, health, or work? You can do that free and anonymous at drtoniwarner.com, where you'll find other resources there as well. Did you benefit from this episode? You can subscribe, like, and share with another to pass it on, because anyone can listen on the go with this podcast audio available on all major podcasting platforms.